Hi, welcome to the Brain Gauge channel. The question today is baseline testing useful, or when do you use baseline testing? And let's talk about that. Let's first of all, what is baseline testing? That's when you take a test before you anticipate that you're going to have an injury. That's really what a lot of people do in the concussion world. So let's take a look at a concussion slide. This is one of the participants. This is the overall score as that person gets better. And you can see that this is just one person in that study. Their initial assessment looked like this, didn't look very good. So, and this is what their recovery looked like. Now, this person did not have a baseline. None of these people in our study had a baseline. And in terms of how well did we do compared to all these other measures that use baseline measures or preseason measures, um, you basically we did pretty well. We outperformed all those things. So, do you need to take a baseline with a brain gauge just to assess an adult with concussion? Keep in mind these were all 18 to 22-year-olds in this particular study, where what this ROC curve shows is that we outperformed all the other measures significantly. And I'm not going to go into all the details of that right now. That's on some other talks. But let's talk about when you should use a baseline. And the answer to that is anytime you anticipate a significant change in the CNS function or in the brain function. For example, blast exposure studies they're not concussive. If you have a big blast exposure, you do get concussion, but you can get blast exposure from things like, just exposure to heavy artillery. If you're looking at treatment efficacy, if you want to see if something that you do, like if you're, something that some treatment that you're giving a patient, is it working, or or how well is it working? Pharmacological studies. We actually did this in one of the studies we looked at. That's how we know that uh, cough syrup is pretty effective for a few hours and how much it impacts. So just a little bit of cough syrup, we can see that show up on the brain gauge. Younger individuals, I'll talk about that later, and the aging population. So the aging population, okay, are you anticipating a big change in CNS function? In younger individuals, it's on the developmental side, and the aging population, it's on the degenerative side. So let's take a look at a couple of examples. One is, let's look at what happens when you take a baseline. Well, in terms of this was the baseline test here and here for these two individuals. And what they did was they were in a blast study where they were wearing blast sensors. And what we're doing is we're correlating the data from the blast sensors to their brain function. And you see that the blast sensor data, this person, each of these people were pretty close to getting 100% on their overall score before they went out and did heavy duty artillery training. They did the heavy duty artillery training here where the red arrow is. And what you see is a little bit of a dip on both of these people. And this time point is 72 hours after exposure. Now, that is by no means a concussed response, but it is a subtle response. They have no symptoms of concussion, but there is a little bit of a dip, and they do recover after a couple of weeks. So, obviously, what we want to do is if you need, one of the reasons you use a baseline is just to detail these very, very minor deviations. So that's really kind of interesting in terms of studies. But now, if you're going to take a baseline, do you need to take all the measures, and which measures do you need to look at? Well, let's take a look at, say, if you're looking at concussion again. This is the there are one thing you need to know is that there's a lot of different physiological processes that are involved with brain injury, and they have different time courses. And look at this. This is minutes, hours, days, weeks, months. Now, do you really want to take something that doesn't even and look at a baseline data for something that's even weeks away from happening after the injury? Well, probably not. You probably want to look at stuff like this that happens immediately because these cause big deviations. Now, let's take a look at brain gauge scores. Now, interesting thing is that in some of the other, a lot of the people that push the other outcome measures and get all bent out of shape about the brain gauge working well. They think that all of our measures should co-vary. And what that means is they think that all the measures should have the same time course. And when you look at this, and this is compiled from thousands of studies, of animal studies, when you look at this, does that give you confidence that all the measures that you're taking should be the same? And if they're all the same, why take more than one? All the brain gauge tests target specific mechanisms, and all these mechanisms have different time courses. So look at these are all brain gauge scores here, and look at that. Some of these recover quickly. Some of these don't even get worse until later. And just so you know, like on a concussion, most concussion symptoms get worse between days 3 and 5 than they are on day 1, usually. It depends on multiple things. These time courses are sensitive to multiple factors. Number one is the injury, and number two, the history, and how, and three is specificity of the injury. Where on the head did they get hit? Where did they? If it was a large enough injury, it's going to be it's going to impact the all brain function, obviously, but it could be a minor injury. Just anyway, the point of this talk is really to decide, okay, if you're going to take just a really minimal test, you just want to hit the ones that are going to show up right away if you want to see what those are. And so you could really benefit with a uh, just doing a reaction time test, just because that is what accidental injury is going to impact, and that's going to recover fairly quickly, 2 to 3 weeks. It'll be completely recovered. But anyway, let's take another look. And one of the, like I said, reaction time is impacted by accidental injury. Let's take a look at what do you do with younger individuals. And like I mentioned, with younger individuals, it's a developmental thing. And so what you want to do is take a look at what happens over development. This is from several hundred individuals testing. We see that reaction times kind of slow under the age of 5, and it does follow a nice pattern. And look at that. All of a sudden, when you've developmental process is over, reaction times around 200 milliseconds. Go watch the reaction time matters slideshow or any of the talks on reaction time, and you can either watch them on this channel or on Grumpy Science, or you can read the full blown paper. But this flattens out, and developmentally, that's one reason you don't have to do baseline testing for this age, but baseline testing can be very important for this age. By the way, the business of sports concussion, where they do baseline testing, well, I don't know, in their before their freshman season, and then use that baseline data for 4 years, is a crock. 4 years is a long time, especially when you're in college. There's a lot of things changing. But anyway, this is something to look at in terms of you want to look at reaction time over this period, if and see how old they are. If they're 12 years old and they're at the early stages of development, and all of a sudden, you know, they they get older. So you never know what's going to happen. Reaction time variability is similar, follows a similar pattern. And the reaction time is your speed, while reaction time variability feeds into your focus score. That's so we do have the ability to focus better as we get older for the most part. Now, there are some exceptions. Obviously, some kids are doing quite well at that test right away. But anyway, I would suggest if you want to do like a quick baseline data test or quick baseline uh, test for people playing sports in these ages, that's not a bad idea. And reaction time is probably all you need. Reaction time with the brain gauge, that is. Go look at the other reaction time talks, and you'll see what I'm talking about. Is that in all humility, we're the only ones. We're between that can do reaction time accurately. We're between 100 and 1,000 times better than other methods. You have to have an accurate method. These studies couldn't have been done without the brain gauge. They wouldn't have gotten reasonable data without it. So anyway, If you have any other questions, please send it to me at info@corticalmetrics.com. That comes straight to me. And thanks for watching. There are plenty of other things to watch on the YouTube channel, and I encourage you to watch them. That's all for now.